Record.
Hello, everyone. I welcome you today to today's lecture. I'm Dr. Abraham. I'll be taking you through the introductory to dermatology. Thank you. So in dermatology, we usually look at a few things. We usually look at the skin. And in this case, we are interested to see how does the skin function, how does the skin look like, and how does it look like when it is diseased. So in dermatology, basically, we are looking at the study of the skin. And in this case, this word dermatology comes from two Latin words. The word derma, which essentially means skin, and then tology, which means study of. So in dermatology, it simply means in layman's language, study of skin. So that's what it means. So usually when you're looking at these structures of the skin, you look at the skin, mucous membranes, we look at the adnexia, and then the appendages, which include hair, nail, and the glands. So if you're looking at this structure macroscopically with your naked eyes, that is dermatology. When you're looking at this structure microscopically, then this is what you call dermatopathology. And when you're looking at dermatology, there's this nice schematic diagram that tries to explain how dermatology works. The conditions that we usually see, we classify them into either inflammatory conditions or neoplastic conditions. So under neoplastic conditions, we know that neoplasia means maybe abnormal growth, and this either can be malignant, meaning that it can spread from one area to another. It can attack surrounding tissue, or these neoplastic processes can give rise to benign conditions. And then we also have what you call metabolic and toxic insults. They also cause skin manifestations, as well as what we call genodermatosis. So under genodermatosis, we usually study all those conditions that can arise from defect in someone's genetic material or in someone's DNA. Then under inflammatory conditions, we have what we call infections. And in these infections, we can either have them being protozoal infections, we can either have them being fungal infections, bacterial infections, viral infections. And then what you have to understand here is that all these give rise to inflammatory processes of the skin. And if you have an inflammation, you should also think about a cause being infectious. Then we have also other inflammatory conditions that are non-infectious. And in this group of disorders, we usually still break them further into papillosquamous disorders. We also break them into urticarias and erythemas. And we also have another group we call autoimmune connective tissue diseases, including discodropathy erythematosus. We have autoimmune blistering conditions like pemphigus vulgaris. So when you look at this schematic diagram, it tries to summarize how dermatology is subdivided. So someone can be asking, when I do dermatology, what else can I become under there? So dermatology is a very big blanket covering so many subspecialties, and all these are up for grabs. So you can become a cosmetic dermatologist, you can become a geriatric dermatologist, you look at all the elderly patients, you can become a pediatric dermatologist, and all these ones are under dermatology, including dermatopathology. So you can study dermatology first, then you go back and do a fellowship in pathology, and then you become a dermatopathologist. So all these are the subspecialties that are under dermatology. So today we shall look at the structure of the skin and how the skin functions. When we talk about skin, this is the largest organ in your body, and it is larger than whatever you have in your body. You know, other people look at other systems, the cardiovascular system, respiratory system, musculoskeletal, but in terms of the size, skin is the largest, and it covers about 1.7 cubic centimeters. This is is an equivalent of around 18.5 feet squared. And basically, from a broad view, the skin is made up of majorly 3 layers, with the outermost layer being called the epidermis, the second layer being called the dermis, and the last layer, we call it the subcutaneous fat. So these layers are further divided and they also vary depending on the region that you are talking about. So for example, when you look at the epidermis, it will be very thick in areas of palms and soles, reaching up to 1.5 millimeters in diameter, and the dermis will be very thick on the back compared to other areas of the body. Then, when you look at the subcutaneous fat layer, it is very thick in the gluteal area and also around the abdomen. You've seen men with big bellies, and that is full of fat. Then, the epidermis, the outer layer of the skin, is further composed of majorly 4 types of cells, and we have the keratinocytes, getting their name from the protein, the major protein they produce, the protein called keratin. And we have other cells, the Langerhans cells. These ones usually act as antigen-presenting cells in the skin. We have melanocytes. These ones help us to produce the pigment we call melanin that gives us skin color and protects us from radiations from the sun. And then we have Meckel cells. These cells are very key and very vital in neuro and endocrine functions have been associated with those 2 systems. Then the dermis, which is the second layer of the skin, this one is usually composed of majorly fibroblasts, and these ones usually lay down what we call collagen fibers and elastin, which is very vital in the structural integrity of the skin. The dermis also has neurovasculature. So these are the nerves, the arteries, the veins, and the lymphatics that supply the skin and also take away the excreta from the skin so that you can go back to the kidney and the liver to be eliminated. Then the dermis has also type 1 mast cells. These are very key in eliciting allergic reactions, and we know that type 2 mast cells are formed in the respiratory system. Then the subcutaneous fat is just basically made out of fat globules, and these fat globules usually coalesce into lobules that give rise to those subcutaneous fat layer. This is what we've been trying to explain. So when you look at this schematic diagram, the epidermis, it is outer layer starting from here, if you're following through up to there. Then from here, then down up to here, this is your dermis. And then lastly down, this is your subcutaneous layer or the subcutaneous fat layer. So these other structures we're going to see one by one, worry not, and we shall cover each and every structure of the skin. So when you zoom in to look at now the epidermis as the outermost layer of the skin, it also further has more 4 layers. Interesting. Eh? So we've said earlier that the skin has majorly 3 layers, and now we are saying the epidermis itself has now more 4 layers. And the outermost of them is what we call the stratum. The word stratum just means layer, and then conium. And this is also called the horny layer. And this is very key because it is composed of special types of dead cells we call coniocytes. And these cells are usually layered in very many thick layers, consisting up 15 to 30 layers of thickness of these flattened cells. So these coniocytes are dead keratinocytes, which have been flattened and usually that develop from the lower layers. And what is important here is that these cells are still filled with keratin, and they are continuously shed as your body interacts with the environment and continuously repressed. So every day you lose a layer of cell, and then every day you get a new layer of cells. So the major function here is that this cell layer provides a very, very good barrier against environmental damage, pathogens, and prevents epidermal water loss or water loss from your skin to the surrounding through conduction, convection, and radiation. So we prevent heat loss, water loss, because of this layer we call stratum corneum. So when you do staining and you look at the skin, so microscopically, or when you do staining of the skin, normal skin with H&E, this is the layer that you are talking about. So this description, we usually call it the basket weave pattern, and all these flattened things that you're seeing here that are like threads, they're actually flattened coniocytes, forming for you that normal basket weave pattern. The subsequent layer, we call it the stratum lucidum. Lucidum just means clear, and then this layer usually is only found in special areas of your body. It is only found in the palms and soles. So because of the nature of the skin and the work that these skin surfaces do, because they're in contact with the environment, they're the ones we use for manipulation, so they tend to be thicker than the rest of the skin. They get an extra added layer to give an additional protection, and that's what we call the stratum lucidum. And from this picture that you see here, so now from here up to here, that is your stratum corneum, the one you've seen earlier, and then the stratum lucidum is this layer that is just next to the stratum corneum. And we've said we find this special layer in palms and soles. The subsequent layer, we call it the stratum granulosum. This is because it has granules, and then these granules are made from a special type of protein we call keratohyalin. And this cell layer, usually it is about 3 to 5 cell layers in thickness, and it is just below the stratum corneum. So what is important is that this layer adds an extra waterproof barrier that allows your skin to conserve water as well as heat and the rest. So this layer, if you're following my cursor, these are the cells. They'll appear bluish if you see this, where my cursor is moving. This outline, these are the cells that constitute the stratum granulosum. Furthermore, we go deeper into the epidermis. The subsequent layer, we call it the stratum spinosum, also called the prickly cell layer. So this is so because the cells in this layer usually have intercellular bridges that are even visible when you do staining. So they appear as if they have spikes going out of the cell. So this cell layer usually has very many cell layers within, and it allows for strength and flexibility of the skin. So if you are to zoom in here to try and show you what we're talking about, so starting all the way from here, if you're following all the way from here up to down here, this is what we call the stratum spinosum. And if you are to see closely in between these cells, like for example, here and here, we have junctions that connect these cells that we call desmosomes. So those desmosomes give rise to the bridges in between the cells that make this cell layer appear spiky or even honing. So that's where the name comes from. So if you are to continue further, the last and the deepest layer of the epidermis, we call it the stratum basal or the basal cell layer. And usually this is one cell layer thick, and it has cuboidal cells, which are stem cells, and they're actively dividing to give rise to new cell layers. So after about 28 days, the cell that was at the base of the epidermis, at the basal cell layer, reaches the upper layer of the stratum corneum. So it takes a cell about a full month, those are 28 days, to move from the basal cell layer all the way up the stratum corneum. And what is interesting here is that this basal cell layer also has other special types of cells. The ones we mentioned earlier, we call them melanocytes, and these melanocytes are very key in making for us the pigment we call melanin. So these cell layers are special. These cells are special, and when you look at them on histology, they'll have this picture. If you're seeing where I'm drawing, let me get another color here. So you see where this color is. So these cells have a characteristic appearance. They have a central nucleus with a clear cytoplasm. So, and how to identify them is that along this basal cell layer, this layer that where the line is being drawn, after about 10 basal cell keratinocyte, you find a melanocyte. And usually this constitutes what we call a melanocytic unit. And in this unit, it is this one melanocyte that transfers melanin to the keratinocytes, because after making the melanin, usually the melanocytes transfer it to the nearby keratinocytes, and they store now this pigment. They take it up by phagocytosis, and then they store this pigment, and this pigment helps to protect the cells from dangers of ultraviolet light. And the other type of cell that we usually find at this level, we call the Meckel cells, though these are very hard to see on H&E. So in my picture, you will not find them. They need special stains for you to see them. Then after finishing the epidermis, what next is what we call the dermo-epidermal junction. So dermo-epidermal junction is that arrangement that you have that connects the epidermis to the dermis. So this arrangement is very, very key because its structures are very vital in maintaining the structural integrity of the skin and to make sure that the epidermis does not peel off from the dermis. And it is also composed of 4 major layers. The first layer, we call it the basal cell plasma membrane, and this is made up of the basal cell layer and all the plasma membrane of the basal cells, the ones that we've seen earlier. So this layer here that you see where maybe this cell touches this arrangement here, that is the first layer of the dermo-epidermal junction. And what you have to notice is that it is this one, it has proteins that span through it to give rise what we call hemidesmosomes. So these proteins that you see here that connect all the way up here, as you've seen, those are the ones we call them hemidesmosomes. So those are the bridges that connect these cells to the underground layers. Then the subsequent layer, we call it the lamina lucida. Lucida just means clear, lamina just means layer. So we have this second layer here where you see that blue line going, and usually it is composed of anchoring filaments, and just below it, then we have what we call the lamina densa. It is called so because it appears darker on the electron microscope. So when you do electron microscope to try and magnify these structures, the lamina densa will appear a little bit darker compared to the lamina lucida. And this lamina densa is usually composed of collagen and laminin fibrils. And these ones basically provide the structural support to the skin. Then we have what we call the sublamina densa, which is just below the lamina densa, and now this is the area. So this one also has what we call anchoring fibrils, and in this arrangement here, they attach to the underlying dermis, and that is the papillary dermis. So the major components of these layers, we shall look at them in details, but what you have to understand here is that the major role of the dermo-epidermal junction is to anchor the dermis and the epidermis together to make sure that they can resist shear forces without necessarily peeling away. And they have a very good clinical pathological correlate is that if we have disease conditions that actually target this arrangement of the dermo-epidermal junctions, those conditions are either congenital, like epidermolysis bullosa acquisita, or even acquired, like those drug reactions, they can target this dermo-epidermal junction. Or even like the acquired autoimmune conditions, like all the blistering conditions, like bullous, like the pemphigoid conditions. So when we look at the general functions of the skin, the first function, I take it to be what we call protection, where the skin acts as a protection barrier against physical injury, pathogens, and harmful substances from the environment. Then it also serves a regulatory function, where it helps you to maintain your body temperature. You see that when it is hot, you sweat, you lose the excess heat, and when it is cold, you have contraction of the erector pili muscles, and then you preserve the heat. Then the skin also serves a purpose of sensation. In this case, it is well innervated, as we shall see later on, and this one allows you to communicate with the environment and respond to the different stimuli, including temperature, pressure, pain, and touch. Then the skin also serves an excretory function, just like the kidney. You will use it to excrete waste products from your body. You see, as you sweat, you lose excess ions and products of metabolism. Then the skin also is very vital in absorption of components or nutrients from the environment, including the sunlight, including even medication. You've seen people applying medications topically, like even pain medications, like a dicrogel, you apply it on the skin, and then it is absorbed through the skin to serve the purpose that you need. Then the skin also has an immune defensive role, and then in this case, your skin is providing a barrier to protect against infection, and it is equipped with both innate immune system and adaptive immune system, as we shall see later on in the subsequent lectures. Then the skin also serves as storage and synthesis function. We see the skin being a center where you store your excess lipids, water, and then also the synthesized vitamin D every time you're exposed to the sun. And when you continue further, when you are to go to the dermis, we said it is the second layer of the skin, and usually it has tough fibrous tissue that enables you to now resist real pressure, because you know the epidermis can easily even peel off by the dermis. It's a bit tougher. This is because it has good composition of collagen fibers and elastic fibers. So the collagen fibers will give us the strength, and then elastic fibers will give us that component of skin to be elastic, that you can pull it and it will go back to, it will go to its previous size or state. And what you have to understand is that all these fibers are embedded within a ground substance, and this ground substance is what we call glucosaminoglycans. And what you have to know is that we also have other cells that are embedded within the dermis, including the dendrocytes. We have the mast cells that we mentioned earlier, histiocytes. We also have vasculature, the neurovasculature, the blood vessels, the nerves, and the lymphatics. So that's where they are located in the dermis. And the dermis is also further divided into two parts, with the upper part being called the papillary dermis, the lower part being called the reticular dermis. And the only the only distinctive difference between these two layers is that the papillary dermis has less collagen bundles compared to the reticular dermis. So even on H&E, the reticular dermis will appear to be less pinkish compared to so the papillary dermis will be a little bit more pinkish compared to the reticular dermis, but there's no clear sharp demarcation between these two layers for sure. And all these fibers, usually they are interconnected, and they give this strong support that our skin needs. So furthermore, what you have to understand is that now even the collagen that we have in the dermis has types. The common collagen, or the majority of the collagen, we have collagen type 1 and 3, and usually these ones give us mechanical support to the skin, and they usually run horizontally within the reticular dermis. Then elastic fibers, for them, they are for recoil, but they're dispersed all the way through without no particular formula. And these fibers are very key, because as you're growing old, these fibers are very sensitive to ultraviolet radiations, and when they're damaged, you get effects of aging. Actually, you get the wrinkling, the solar elastosis, and all this is because of damage to the elastic fibers. And what you have to know, that our ground substance is where you have now these collagen fibers embedded and being supported and nourished, like it's like a base. It is like how you see plasma in blood. This is the equivalence of plasma, but this time round you are having it in the dermis. Then we have blood supply to the skin, and this blood supply to the skin, if you are to go to this schematic diagram so that I show you, this blood supply to the skin, we usually divide it into what we call plexus. A plexus is a group of blood vessels. So in the skin, we have two of them. So the first one, we call it the superficial plexus, and this plexus, the superficial one, is the one that is located just between the epidermis and the papillary dermis. So all that you see up there that makes such an arrangement that I'm painting is the superficial plexus. Then below, between the dermis and the subcutaneous fat layer, this is what we call the deep venous, the deep vascular plexus. It has both veins and arteries. So we have what we call perforating branches or perforating blood vessels that connect these two plexuses, and that's how they look like. So for them, they are perpendicular to the surface of the skin, whereas the superficial and the deep plexus, they usually run along the skin. And for the neural component, we have nerve endings in the skin. Usually, we have the ones that are myelinated and non-myelinated. So for the ones that are myelinated, okay, the ones that are myelinated, they usually end in the dermoepidermal in the